My name's Amie Starks. I'm the Educational Resource Nurse and the Diabetes Educator here at Rapides Regional Medical Center, and I'd like to welcome you back to the Dish on Diabetes, a continuing web series here at Rapides Regional Medical Center. So today's topic is to prick or not to prick. As a diabetes educator, I get a lot of questions about what do my blood sugar levels mean? Where do I prick my finger? What do I do before I prick my finger? So today, I'm going to answer a couple of those questions. First things first is prepping to prick your finger. First things first is you need a clean surface. We all have staph on our bodies, and not cleaning that area can introduce staph into the body, which can cause some complications. So first things first, you want to take an alcohol prep and you want to wipe that area that you're going to stick, or you can use warm soapy water, and that warm water actually dilates the capillaries, which gives you a better blood sample. So now that you know what to do in prepping to prick your finger, let's talk about where we're going to prick. So to get a good sample, and let's face it, if we're going to stick ourselves, we want to get a good blood sample. So first things first, you want to locate the third or fourth finger, and I'm just going to use this one here. You're going to draw an imaginary line in the middle of the finger and the side of the finger, and you're going to stick between there. The closer you can get to the side of the finger, the better, because the pad actually has tons of nerves in that pad, so it can hurt. The closer we get to the side of the finger, we get better blood samples and not a lot of nerves, so it doesn't hurt as much. Another thing is no milking the finger. A lot of people like to take the finger and milk it. Well, what that does is it can cause you to get the fluid around the red blood cell, but not actually the blood cell. So no milking the finger, just making sure you use that warm soapy water, or milking it before you stick, but not afterwards. Another thing is, what do you do with those readings? Let's say you stick your finger and you get below a 100 or something. You need to make sure that you record those readings. You want at least 3 readings. It needs to be done on the same equipment, so the same glucometer that you used the first time, we want you to use it the second and third time. Consistency, meaning the time of the day that you're checking your sugar. Usually a fasting blood sugar is nothing to eat or drink for 8 or 9 hours prior to sticking your finger, pricking your finger. So let's say you get a reading of 102, okay? An optimal reading would be below 100 for fasting. Between 100 and 125 is a pre-diabetic range. Anything from 125 or above is a diabetic range. So let's say you prick your finger and you get a 109. Well, that's elevated. That puts you in a pre-diabetic range. But you can't call your physician and say, I was 109 this morning. You need at least 3 readings. And make sure that you record those down on a logbook, and you bring that logbook to your physician's appointments. So the first thing was to prick. Now we talk about what, to prick or not to prick. Well, suppose you choose not to check your blood sugar. That's a big no-no in diabetes management. The first thing that I worry about as a diabetes educator is, if you don't know what your blood sugar levels are running, how do you know that you need to call your physician? Plus, it predisposes you, puts you at very, very high risk for diabetic complications, which could be blindness from retinal damage, kidney damage, cardiovascular damage in your heart attack, stroke, things like that. So you want to know what those blood sugar readings are so you can call your physician, so you'll know when to call your physician. The other thing I'd like to add is that diabetes has a way of sneaking up on you. You feel fine. You don't feel like your blood sugar's high, but a lot of times you don't know that your blood sugar's high or low until you check your finger. So I'm going to leave you with this question today. To prick or not to prick?